You may have heard of creatine for athletes, but what if I told you that creatine could also be helpful in perimenopause and menopause for brain, muscle, and bone health? Hi, I'm Dr. Patricia Mills, holistic medical doctor with a natural root cause approach to your health concerns, and welcome to the Wild Wisdom Show. Today, we're going to be talking about creatine and menopause, the surprising link that every woman should know. Now, because creatine is found in lower stores in women compared to men, about 70 to 80% less creatine, we need to get curious about whether or not supplementing creatine could be helpful for women, especially because levels seem to change according to the change in our levels in our estrogen. So today, what we're going to cover is how it works, what are the benefits according to research on women, dosing for women, and potential side effects. Now, how it works is that to boost the brain and muscle energy, creatine helps your body quickly recharge its main energy source, which is ATP or adenosine triphosphate, so that you can feel stronger, sharper, and more energized during intense moments of physical activity and perhaps even beyond. And because of that, creatine in research has been found to support memory, mental clarity, mood, and physical endurance, especially as estrogen declines. And therefore, it could be a hormone helper during times of estrogen shifts, whether it's during periods, pregnancy, postpartum, and during menopause and the menopause transition. Now, the research shows that there is real benefits in menopause in particular. So there's benefits in muscle strength, in bone health in terms of the bone structure and geometry, brain function, and mood support. But I want to say that creatine, like every other supplement, is not a magic pill. For example, creatine on its own won't improve bone density. It needs to be combined with things like a strength training program and a diet that is anti-inflammatory, because inflammation will cause minerals to be pulled from the bone. So you can't just take creatine and expect to see improvements. You need to have a holistic approach to these health concerns in order to get the best benefits. Now, when we're looking at research, the dosing option seems to be you can start with a loading phase where you start with a higher dose of creatine over a period of 5 days, and then you reduce the dose. So that loading dose could be anywhere between 16 to 20 grams a day of creatine. And then after the 5 days, you go down to 5 grams per day. Now, the thing is that you can also not do the loading phase and just do the daily dose of 3 to 5 grams per day. And I'll be talking about why this might be something that you want to consider in terms of reducing the risk of side effects. Now, when you're taking those grams of creatine, the best way to do it is to mix it in water. I've seen the recommendation to mix it with juice, and my concern is that you start to get a lot of simple sugars in your diet, especially if you're having creatine every day. And so ideally with water, and having it with a protein-rich milk can also be helpful. Some people will say that it needs to be consumed with carbohydrates. That's not the case. It works just as well without it. So you don't have to add carbs in order to get the creatine benefits. Now, a brain boost protocol could look something like that: 15 to 20 grams a day for 3 to 7 days, and then 5 to 10 grams per day. So every research study uses a slightly different dose. Some studies will do that loading dose followed by the lower dose, and others will just do that lower dose and stay at that lower dose for a longer period of time. The benefit of a loading dose is you get higher stores of creatine in a short amount of time. But the downside I will talk about is that you could increase your risk of side effects during that loading dose phase. When it comes to creatine in your cycle, this is a video for primarily women in menopause, but some of you are watching premenopause and, curious about creatine, and it shows that the best time to take creatine during that cycle is during your luteal phase. You get higher protein, muscle protein breakdown, and creatine could help protect your muscle mass during this time when estrogen levels are changing. It's important to understand also that everybody responds differently. And so whenever you're going to try something different, like adding a supplement such as creatine, you definitely want to track your body's response. Some people may feel side effects and some people may feel nothing. So understanding how your unique body responds to something is very crucial, and not to just assume that it'll respond well, but rather to really keep an eye on things so that if something happens, you can identify the supplement as the cause and reduce the dose or stop it altogether. Now, the side effects actually are not significant in terms of the studies. Studies have shown that short-term use of creatine really doesn't affect things like liver health or kidney health. Now, longer doses for longer periods of time have not been studied. And the concern is that creatine is cleared by the kidney. So it may be that if you're on a very high dose of creatine for a long period of time, that you could run into problems with your kidney function. So if you're taking creatine regularly, you may need to get your kidney function tested by your doctor once or twice a year, just to make sure that your kidney function isn't being affected in a negative way by taking the creatine. The one thing that I have heard anecdotally, in the sense that I haven't seen this reported in research on women, it has been reported on research in men, and that's water retention. So getting some swelling or weight gain from the body holding on to water. And that seems to be because there's just more molecules in the body, molecules inside of the cells. The cells then absorb more water, and it's called cellular hydration. And so that could be a good thing in terms of more hydration, but I have heard of some women that experience significant swelling upon starting the creatine, and they don't like that. And the good news is that if that happens, when you stop the creatine, that swelling goes down, and that swelling is less likely to happen if you don't do that loading dose. If instead you do the lower dose, 3 to 5 grams a day, and just wait for longer for those creatine stores to build up, but lower your risk of potential side effect of water retention and swelling. Now, I always want to share how I take this information and whether or not I'm taking the supplement that I'm talking about. Full disclosure, I am not taking creatine. I'm using other methods, other approaches, including exercise, resistance training, a really healthy anti-inflammatory diet that's rich in vegetables. I am omnivore. I get lots of different sources of nutrients in my diet. And so I'm using that strategy in addition to other supplements that include things like vitamin D in the winter and some collagen, some chlorella, magnesium, and other supplements depending on how I'm feeling and how I'm doing. Creatine is currently not one of the things that I'm taking, but I'm going to keep it in mind. And if I experience certain issues like muscle loss or problems with brain, function going into menopause, I'm going to use one of these strategies, such as taking creatine, to see if I can offset those, signs and symptoms of aging with a tool like creatine. But for now, I'm not taking it. However, I do know a lot of women who are interested in taking it. And if you are, I want you to remember the bottom line, which is every supplement is a tool and not a cure. It needs to be used in a holistic way. If you are very, very inflamed, for example, and you're adding a lot of creatine, we don't know, maybe that could make the inflammation worse. So you want to make sure that you're addressing your health holistically, and then you add something like creatine if you're going to, very carefully monitor yourself, assess your personal response to it, and decide for how long you want to keep it on, because these studies, again, they're not done for very long periods of time. It's usually a few weeks, maybe a few months. It's definitely not something that is studied as being taken every day for years on end. So keep that in mind and make sure that you're always addressing your health holistically through diet, sleep, exercise, stress, toxins, and detoxification pathway support, which will get you the best response with these supplemental add-ons that could perhaps improve your outcomes. Now, if you want to learn more about how to address your health holistically during perimenopause, menopause, to prevent or treat osteoporosis and support your hormone health, please check out my YouTube channel at drpatriciamills. Go to the playlists. I've got playlists for each of these topics and videos within these playlists that you're going to find incredibly helpful. And check out the caption below for some links that you can use to get to those playlists even faster. If you enjoyed this episode, the best way to support the Wild Wisdom Show is to subscribe. It really is helpful to get this information out to more people. Save this for future reference and share. Sharing is caring, and you never know when someone you love is going to benefit from this wild wisdom. Thank you for joining me today. I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this, and I'll see you next time. Bye now.